More than 60% of adults in long-term care settings experience sudden dizziness when standing up, yet most blame it on age. But what if the real culprit is your blood pressure medication working too well, and there is a simple way to catch this before a fall? Stay with me because the warning sign I will reveal at the end is something your doctor needs to hear, but most people never report. In the next few minutes, you will discover the 6 mistakes that quietly sabotage blood pressure treatment after 55 years old. A case crossover study of more than 90,000 older adults found a significantly higher risk of serious fall injuries in the 15 days after starting or intensifying blood pressure medication, and I want to know in the comments what part of the world you are watching from. You know that feeling when you stand up and the room spins for a second, or that wave of tiredness that seems to come from nowhere? According to research from institutions studying older adults, orthostatic hypotension, that sudden drop in blood pressure when you stand, reaches as high as 60% in long-term or acute care settings, and many never connect it to their pills. Think of blood pressure like the water pressure in your home. You need enough to reach every room, but too much bursts the pipes. The good news is your body gives very clear signals when the pressure is too low, and catching them early can prevent a dangerous fall. What is the one mistake that happens every single morning without anyone noticing? Why do some people in their 70s and 80s feel energetic and steady, while others struggle with dizziness and brain fog? And what is the simple fix that your doctor can adjust in one visit? These are the questions we are going to answer together right now. Blood pressure naturally rises with age because the walls of your arteries become stiffer, like old garden hoses that lose their flexibility. That is why high blood pressure is so common after 55, and why medication becomes a daily part of life for millions of adults. But here is what most people do not realize. The dose that worked perfectly 5 or 10 years ago might be too strong today. As your body ages, your kidneys process medication more slowly, your heart responds differently, and even your weight can change how the pills work. Most people believe the solution is simply to take the pill every day and check the numbers, but the science showed that is only part of the story. There are small, everyday mistakes that can turn a helpful medication into a hidden risk, and most of them happen without anyone noticing. Right now, I'm going to walk you through the 6 mistakes that sabotage blood pressure treatment in older adults. And trust me, the last one is the most important. In fact, at the end, I'm going to give you a simple rule to remember all of this. So stay close and pay very close attention to what comes next. Mistake number 1. Taking your medication irregularly or skipping doses without realizing it. And this is the most familiar slip of all. Memory lapses are completely normal as we get older, and when you take multiple pills every day, it is easy to lose track of whether you already took today's dose. Skipping even one dose can cause your blood pressure to spike temporarily, and your body experiences a roller coaster effect that stresses your heart and blood vessels. According to medication adherence studies, inconsistent dosing is one of the top reasons blood pressure stays uncontrolled, despite being on the right medication. The solution is remarkably simple. Get a weekly pill organizer with compartments for each day, and fill it once a week at the same time. Set a daily alarm on your phone or watch as a backup reminder, and place the organizer next to something you use every morning, like your coffee maker or toothbrush. If you live with family, ask them to help you check the organizer at the end of each day to confirm the dose was taken. Some people even take a photo of the empty compartment each day as a visual confirmation, which works beautifully for peace of mind. Pharmacists can also set up blister packs that organize all your medications by date and time, taking the guesswork out completely. The key is to build a system that does not rely on memory alone, because consistency is what keeps your blood pressure stable and your heart protected. If this sounds like something you have struggled with, you are definitely not alone, and the fix is easier than you think. But if you think skipping a pill here and there is the biggest problem, wait until you hear about the mistake that happens right in your own living room. This next one is so common that it tricks people into thinking their pressure is out of control when it might actually be fine or worse. Makes them think everything is normal when it is dangerously high. And the wild part is, it all comes down to where you rest your arm while taking the reading, something almost nobody gets right. You have probably done this yourself without realizing it, so let me explain exactly what I mean. Have you ever wondered why your home readings never match what the doctor gets at the office? Mistake number 2 is about to answer that question for you, and it is going to change the way you measure your blood pressure forever. Mistake number 2, measuring your blood pressure wrong at home. And this one is a silent saboteur that leads to false readings and bad decisions. You might think checking your pressure at home is straightforward, but small mistakes in technique can throw the numbers off by 10 or even 15 points. Resting your arm in your lap instead of supporting it at heart level raises the top number by about 4 points, and letting your arm hang at your side raises it by about 7. A full bladder can add 10 to 15 points, and talking during the reading can add another 10, So even a casual conversation with your spouse can make your pressure look dangerously high when it is actually normal. According to clinical guidelines, the most reliable readings come from a validated upper arm monitor, not a wrist or finger device, because those are less accurate and can vary wildly depending on wrist position. Here is the correct technique. Sit quietly for at least 5 minutes before you measure, with your back supported and your feet flat on the floor. Rest your arm on a table or armrest so the cuff is at the same height as your heart. Do not hold your arm up in the air or let it dangle. Do not talk, do not check your phone, and make sure your bladder is empty. Then take 2 or 3 readings 1 minute apart and write down the average. Always measure at the same time of day, ideally in the morning before breakfast and medication, and again in the evening before dinner, because pressure naturally fluctuates throughout the day. Keep a simple written log with the date, time, and both numbers, and bring that log to every doctor appointment so your doctor can see the pattern over weeks and months. False readings drive bad decisions. If your home numbers are falsely high, your doctor might increase your dose unnecessarily, and if they are falsely low, you might miss a real problem. Investing in a good upper arm monitor and learning the right technique is one of the smartest things you can do to protect your heart. This is not just about getting accurate numbers, it is about giving your doctor the real information they need to keep you safe. But even if you measure perfectly, there is another mistake that happens at the pharmacy, and this one involves something you probably keep in your medicine cabinet right now. Most people have no idea that the painkiller they take for a headache or sore knee is quietly working against their blood pressure medication. And the scary part is, it happens so gradually that you never connect the two. You just notice your pressure creeping up and wonder why the pills stopped working. Mistake number 3, assuming over-the-counter painkillers are harmless. And this is a myth that catches almost everyone by surprise. Ibuprofen, naproxen, and most non-steroidal anti-inflammatory drugs, the ones you take for arthritis pain or a pulled muscle, can raise your blood pressure. According to drug interaction references, ibuprofen can push the top number up by roughly 3 to 4 points, and it quietly blunts the effect of nearly all blood pressure medications except calcium channel blockers. The mechanism is straightforward. These painkillers cause your kidneys to hold onto sodium and water, which increases the volume of fluid in your blood vessels and raises the pressure. For someone taking blood pressure medication every day, adding ibuprofen 2 or 3 times a week can undo much of the benefit. And the effect is dose-dependent, meaning the more you take, the bigger the problem. Acetaminophen is generally the safer over-the-counter option for pain relief because it does not have the same effect on blood pressure or kidneys. But here is the critical step. Before you take any painkiller, cold remedy, or even a decongestant, check with your pharmacist first. Many cold and sinus medications contain ingredients that raise blood pressure, and combining them with your regular pills can be a recipe for trouble. Pharmacists are incredibly knowledgeable about drug interactions, and a quick conversation at the counter can save you from a dangerous spike or an unexpected trip to the emergency room. If you rely on ibuprofen or naproxen for chronic pain, talk to your doctor about alternatives that will not interfere with your blood pressure control. The key takeaway is this: just because something is sold over the counter does not mean it is safe for everyone, especially if you are managing high blood pressure. Read labels carefully, ask questions, and never assume that a pill is harmless just because you do not need a prescription. But you know what is even more dangerous than taking the wrong painkiller? It is stopping your blood pressure medication altogether because you feel fine. This next mistake is rooted in a myth that has been around for decades, and it is one of the most common reasons people end up in the hospital. You are about to learn why feeling good is not the same as being safe, and why stopping certain pills abruptly can trigger a medical emergency. Have you ever thought about cutting your dose in half just because your numbers look good for a few weeks? Mistake number 4, stopping or cutting your dose because you feel fine, and this is where myth number 2 comes in. Feeling fine does not mean your pressure is controlled. High blood pressure is called the silent killer for a reason. It causes no symptoms in most people until it damages your heart, kidneys, brain, or eyes. You can feel completely normal with a blood pressure of 160/100, and you can feel tired and off with a perfectly normal reading of 120/70. The numbers tell the truth, not how you feel, and that is why regular monitoring and consistent medication are so important. But here is where it gets even more serious. Abruptly stopping certain blood pressure medications, especially beta blockers and clonidine, can trigger rebound hypertension. Rebound hypertension means your pressure shoots up suddenly, often higher than it was before you started the medication, and that spike can lead to a heart attack, stroke, or hypertensive crisis. According to clinical studies, a single missed dose is very different from stopping entirely. Missing one dose might cause a small temporary rise, but stopping cold turkey can be genuinely dangerous. If you're experiencing side effects, or you believe your dose is too strong, the solution is never to stop on your own. The solution is to call your doctor and discuss it. Your doctor can adjust the dose gradually, switch you to a different medication, or confirm that what you are feeling is not related to the pills at all. Many people stop their medication because they read something online or heard from a friend that they do not really need it. But your treatment plan is based on your specific health history, your numbers, and your risk factors. What works for someone else might not work for you, and what feels right to you might not be what your body actually needs. The bottom line is this: never start, stop, or change your blood pressure medication without talking to your doctor first, even if you feel great. Consistency saves lives, and your heart depends on that daily dose to stay protected from the silent damage that high pressure causes over time. Now, here is where things get really interesting, because the next mistake is about timing, and it is based on advice that millions of people still follow, even though science proved it wrong. For years, doctors told patients to take their pills at night because it was supposed to protect the heart better, but a major trial turned that advice completely upside down. If you have been stressing about what time of day to take your medication, you are going to want to hear this next part very carefully. Mistake number 5. Believing your pills must be taken at night to work, and this is myth number 3, a piece of advice that sounded scientific but turned out to be wrong. After 2 older studies, the MAPEC trial in 2010 and the HiGear trial in 2019, suggested that taking blood pressure medication at bedtime was better for preventing heart attacks and strokes. Millions of people switched their pills to nighttime. But then came the large time trial in 2022 and the BedMed trials in 2024, and both found no difference in cardiovascular outcomes between morning and evening dosing. According to these newer and larger studies, the time of day you take your medication does not change how well it protects your heart. What matters is that you take it consistently at the same time every single day. So if you are a morning person and you never forget your pills with breakfast, take them in the morning, and if you are more reliable at night with your bedtime routine, take them at night. The goal is to pick a time when you are least likely to forget, because consistency is far more important than the clock. Some medications do have specific timing instructions. For example, certain diuretics are usually taken in the morning, so you are not waking up all night to use the bathroom. But for most blood pressure pills, the choice is yours, and your doctor or pharmacist can confirm the best time based on your specific medication and lifestyle. This myth caused a lot of unnecessary stress and confusion, with people setting alarms for the middle of the night or worrying they were doing it wrong if they took their pills in the morning. The truth is, your body does not care whether it is 8 in the morning or 8 at night. It cares that the medication is in your system every day at roughly the same time. Now you might be wondering, if timing does not matter and taking the pills consistently is the key, then what is the mistake that actually causes the most harm? We have covered skipping doses, measuring wrong, painkillers, stopping abruptly, and the night timing myth, but none of those is the most dangerous one. The most overlooked mistake is the one that hides in plain sight. It is the one your doctor might miss if you do not speak up, and it is the reason this video exists. What I am about to reveal is the single most important thing you need to watch for if you are over 55 and taking blood pressure medication. This is the mistake many seniors do not notice, and it is the one that can lead to a fall, a broken hip, or worse, all because the symptoms get blamed on just getting older. Pay very close attention to this next part, because this is the information you need to take to your doctor at your very next appointment. Mistake number 6, and this is the big one: blaming dizziness, fatigue, or near fainting on just getting older, instead of recognizing it as a warning sign that your blood pressure medication might be too strong. Here is the surprising truth that most people never hear. In older adults, blood pressure that is pushed too low by medication can be just as dangerous as pressure that is too high. When your pressure drops too much, especially when you stand up, it reduces blood flow to your brain, and that causes dizziness, lightheadedness, confusion, and even fainting. This condition is called orthostatic hypotension, and it is shockingly common in people over 65, affecting as many as 60% of those in long-term or acute care settings. The problem is, most people and even some doctors assume these symptoms are just a normal part of aging, so they never connect the dots back to the medication. But here is what the research shows. A dose that was perfect for you at age 60 might be too strong at age 70 or 75 because your body changes. Your kidneys process medication more slowly, your heart pumps differently, your blood vessels are stiffer, and even your weight and activity level affect how the pills work. A case crossover study of more than 90,000 adults aged 65 and older found a significantly higher risk of serious fall injuries in the 15 days after starting or intensifying blood pressure medication. Falls are not a minor issue for older adults. A fall can mean a broken hip, a head injury, a loss of independence, or even death. And if your medication is causing dizziness or weakness, that fall risk goes way up. The signs to watch for are dizziness or lightheadedness when you stand up from sitting or lying down, unusual tiredness or weakness that was not there before, trouble concentrating or brain fog that seems to come and go, and any near fall or moment where you had to grab onto something to steady yourself. If you are experiencing any of these symptoms, do not brush them off as just part of getting older. Write them down and report them to your doctor at your next visit. Ask your doctor to check your blood pressure both sitting and standing, because the standing measurement is the one that reveals orthostatic hypertension, and many doctors only check it while you are seated. Your doctor can adjust your dose, switch you to a different medication, or confirm that your symptoms are not related to your blood pressure at all, but they can only help if you speak up. This is not a reason to stop taking your medication. High blood pressure is still dangerous and needs to be treated, but it is a reason to make sure your dose is right for your body today, not the body you had 5 or 10 years ago. The mistake many seniors do not notice is staying silent about these symptoms, assuming they are normal, and missing the chance to prevent a serious fall or injury. If you take away just one thing from this video, let it be this: dizziness and fatigue are not always just aging. Sometimes they are your body telling you that your medication needs a second look. Now pay very close attention, because everything you have heard up until today about blood pressure medication might be incomplete or even wrong. If you take away just one thing from this video, let it be this: dizziness and fatigue are not always just aging. Sometimes they are your body telling you that your medication needs a second look. Now pay very close attention, because everything you have heard up until today about blood pressure medication might be incomplete or even wrong. Myth number 1, the belief that over-the-counter painkillers like ibuprofen are harmless. But a review of drug interaction data showed that non-steroidal anti-inflammatory drugs can raise blood pressure by 3 to 4 points and reduce the effectiveness of nearly all blood pressure medications except calcium channel blockers. But a review of drug interaction data showed that non-steroidal anti-inflammatory drugs can raise blood pressure by 3 to 4 points and reduce the effectiveness of nearly all blood pressure medications except calcium channel blockers. Myth number 2, the idea that you must take your blood pressure pills at night to protect your heart. But the large time trial in 2022 and the BedMed trials in 2024 both found no difference in cardiovascular outcomes between morning and evening dosing, so take them whenever you are least likely to forget. The correct approach is the one we just walked through together. Measure your pressure correctly, avoid medications that interfere, take your pills consistently at the same time every day, and most importantly, report any dizziness or fatigue to your doctor, instead of assuming it is just part of getting older. Here is your simple, practical protocol to follow starting today, and this is the step-by-step checklist that will keep you safe and in control. Step 1. Use a validated upper arm blood pressure monitor, not a wrist or finger device, and follow the correct technique every single time. Sit quietly for 5 minutes with your back supported and feet flat. Rest your arm at heart level on a table. Do not talk and make sure your bladder is empty before you measure. Step 2. Keep a simple written log with the date, time, and both numbers, and bring that log to every doctor appointment so your doctor can see the pattern over weeks and months, not just one reading in the office. Step 3. Write down and report any dizziness when standing, unusual tiredness, brain fog, or near falls, and ask your doctor to check your blood pressure both sitting and standing at your next visit, because the standing measurement is the one that reveals if your dose is too strong. Step 4. Never start, stop, or change your dose on your own. Always talk to your doctor first, even if you feel great or even if you feel terrible, because abrupt changes can be dangerous. Step 5. Clear every over-the-counter painkiller, cold remedy, or supplement with your pharmacist before you take it, because many of them interfere with blood pressure medication in ways you would never expect. Step 6. Keep one up-to-date list of all your medications, including over-the-counter pills and supplements, and try to fill all your prescriptions at a single pharmacy so the pharmacist can catch dangerous interactions before they happen. Remember this simple rule: measure right, report symptoms, and never change a dose without your doctor, because your heart depends on consistency and communication. Now, before we wrap up, there is one more critical mistake people make with supplements and natural remedies, and I'm going to cover that in the next video. A quick word about when to seek urgent care if you ever see a very high reading. Around 180 over 120 or above, especially with symptoms like severe headache, chest pain, shortness of breath, or vision changes. That is a hypertensive emergency, and you need to seek medical care immediately. Do not wait. The same goes for fainting or a fall with injury. Those are red flags that need immediate attention, not a wait-and-see approach, so trust your instincts and get help fast. Thank you so much for watching. If this helped you, please hit the like button. And I would love to know in the comments if you have ever experienced dizziness when standing up and whether you reported it to your doctor. And please share this video with anyone over 55 who takes blood pressure medication, because this information could prevent a fall or save a life. In the next video, I am going to reveal the hidden danger in one supplement that millions of older adults take every single day, believing it is protecting their heart when it might actually be raising their blood pressure. You will find 2 videos on your screen right now. Thank you again for being here and taking charge of your health. and I will see you in the next one. In the next video, I am going to reveal the hidden danger in one supplement that millions of older adults take every single day, believing it is protecting their heart when it might actually be raising their blood pressure. You will find 2 videos on your screen right now. Thank you again for being here and taking charge of your health, and I will see you in the next one.